Chapter 49, Sensory Alteration. All individuals rely on a variety of sensory stimuli to provide meaning and order to the events occurring in their environment. The senses form the perceptual base of our world. Sensory stimuli reach the sensory organs to elicit an immediate reaction or store information in the brain for future use. The nervous system must be intact for sensory stimuli to reach appropriate brain centers and for an individual to perceive the sensation. After interpreting the significance of a sensation, the person is then able to react to the stimulus. Perception begins with stimulation of a nerve cell called a receptor. This is usually for only one type of stimulus, like light, touch, taste, or sound. When a nerve impulse is created, it travels along pathways to the spinal cord or directly to the brain. Sensory nerve pathways usually cross over to send stimuli to the opposite sides of the brain. The perception or awareness of unique sensation depends on the receiving region of the cerebral cortex, where specialized neurons interpret the quality and the nature of the sensory stimuli. When a person becomes conscious of a stimulus and receives the information, perception takes place. There is a balance between sensory stimuli entering the brain and those reaching conscious awareness to maintain a person's well-being. Sensory alterations occur when an individual attempts to react to every stimulus within the environment, or if the variety and quality of the stimuli are insufficient. Consider what assessments are needed for this patient. When a deficit develops gradually, or when considerable time has passed since the onset of an acute sensory loss, a person learns to rely on unaffected senses. Some senses may even become more acute to compensate for an alteration. There are various effects of sensory deprivation. For cognitive, it is the reduced capacity to learn, inability to think or problem solve, poor task performance, disorientation or confusion. For affective, it may be boredom, restlessness, increased anxiety, emotional liability, increased need for physical stimulation. For perceptual, it may be changes in visual or motor coordination, reduced color perception, changes in ability to perceive size and shape, changes in spatial and time judgment. Infants and children are at risk for visual and hearing impairments because of various genetic, prenatal, and/or postnatal conditions. Hearing begins to change at the age of 30. Proprioceptive changes common after the age of 60 will include an increased difficulty with balance, spatial orientation, and coordination. What health promotion activities would you consider for this patient? Clinical judgments require the nurse to anticipate the information necessary, analyze the data, and make decisions regarding patient care. Patients' conditions are always changing. When conducting an assessment, value the patient as a full partner. This will ensure a more thorough database to plan, implement, and evaluate care. Patients are often hesitant to admit sensory losses. Determine if the patient is at risk for a sensory alteration. Older adults are a high-risk group because of normal physiological changes involving sensory organs. Assessment of mental status is valuable when the nurse suspects sensory deprivation or overload. Assess the patient's functional abilities within their home environment or the healthcare setting. Include the ability to perform feeding, dressing, grooming, and toileting activities. Patients with sensory alteration are at risk for injury if their living environments are unsafe. To understand the nature of a communication problem, the nurse needs to know whether a patient has trouble speaking, understanding, naming, reading, or writing. Patients with existing sensory deficits often develop alternate ways of communicating. What would be some possible nursing assessment steps? The possibilities might include reviewing with the patient at each visit the importance of an early intervention through regular vision examinations. The provision of information about side effects of visual impairments and the encouragement of the use of visual and adaptive devices when possible. Ask the patient how they're coping with visual alterations. Ask the patient about social networks and supporting relationships. Assess for changes in mood and depression. An elderly patient who lives in an adult assisted living facility mentions that he is experiencing hearing and vision changes. During your assessment, you would associate this type of sensory deprivation with stable affect, altered perception, improved task completion, increased need for social interaction. The answer is B, an altered perception. After assessment review of all available data, look critically for patterns and trends suggestive of a nursing diagnosis or a health problem relating to sensory alterations. The validation of findings is necessary to ensure the accuracy of a nursing diagnosis. Considering a nursing diagnosis, think about risk for falls related to visual alterations from cataracts. During the planning phase, synthesize information from multiple resources. Reflect on knowledge gained from the assessment and knowledge of how sensory deficits will affect the normal functioning. What possible outcomes would you include? Think about having the patient report an increased sense of home safety and independence within 2 weeks. The patient and the son will make recommended changes to the home environment within 4 weeks. These are some potential outcomes that might be included. Good sensory function for all patients begins with prevention. The pupil's ability to adjust to light will diminish as a result of normal changes of aging. Older adults are sensitive to glare. When sensory function becomes impaired, individuals become less secure within their home and workplace. Security is necessary for a person to feel independent. As a nurse, we make recommendations for improving safety within a patient's living environment without restricting their independence. A sensory deficit often causes an individual to feel isolated because of an inability to communicate with others. It is vital for individuals to be able to interact with individuals around them. The nature of the sensory loss will influence the methods and styles of communication that the nurse will use during interaction with patients. When patients enter acute care settings for therapeutic management of sensory deficits or as a result of a traumatic injury, they use different approaches to maximize sensory functioning existing at the time. Safety is an obvious priority until the patient's sensory status is either stabilized or improved. A patient with a sensory impairment requires a complete orientation to the immediate environment. Provide reorientation as needed to the institutional environment by ensuring that name tags on uniforms are visible, addressing the patient by name, explaining where the patient is, and using conversational cues to time or location. Older adults and reducing loneliness in patients with sensory impairments is vital. Spending time with a person in silence or conversation. When it is culturally appropriate, use physical contact to convey caring. Recommend alterations in living arrangements if physical isolation is a factor. Help patients connect with people important to them. Provide information about support groups or groups that will provide assistive services. Arrange for security escort services as needed. Introduce the thought of bringing a companion when appropriate. Link a person with organizations attuned to the social needs of older adults. Interventions that apply to these rationale. Recommend that a non-glare work surface is installed in the kitchen area. Recommend incandescent lights in the home. Identify potential trip hazards such as throw rugs and suggest that they be modified or removed. For fall prevention, teach methods to improve environmental safety, like installing handrails along the stair, securing carpeting, removing throw rugs. Suggest non-slip surfaces in the bathtub and the shower. A patient with glaucoma is being discharged from the hospital. When teaching the patient and family ways to improve home safety, the nurse tells the family to use throw rugs to prevent tripping, paint the floor black and white to improve perception, install extra incandescent lighting, install handrails painted the same color as the walls. The answer is C, installing extra incandescent lighting. What responses would indicate that the outcomes have been achieved? It is important to evaluate whether patients perceive that care measures maintained or improved their ability to interact and function within the environment. The patient is the source for evaluating whether their expectations were met. If you have directed nursing care at improving or maintaining sensory acuity, evaluate the integrity of the sensory organs and the patient's ability to perceive the stimuli.